Now to this week's Fox 7 Focus. It is November, and this month a lot of guys are growing their beards out to raise awareness about men's health. Tonight we're delving into some of those issues that men are often reluctant to talk about. To do that, we're joined by Dr. Stuart Wolf, a urologist with Dell Medical School and Seton Urology Group. Dr. Wolf, thanks for being here.
Great to be here. Thank you.
So first, I want to ask you just in general, a lot of men don't like to talk about their health or maybe even pay close attention to their health. As a doctor, specifically a urologist, how big of a problem is that?
Unfortunately, it's a big problem. We see disease that has advanced beyond where it really should be if we had used normal early detection methods. And unfortunately, men are not always very good about, doing what they should be doing in terms of maintaining their health.
So let's go through some of the common cancers that impact men. Prostate cancer, that's a big one. It's the second leading cause of death for men. What do guys need to know about it, and what should they be doing? I know that's something that sort of depends on your age, right?
Absolutely. There used to be a lot of controversy about prostate cancer screening, but now we've actually settled, I think, into a pretty reasonable place where we generally, if you're a typical man, we're going to want to start screening around age 55. We usually use a PSA blood test. They used to be all we had was a blood test. We now have additional tests, including imaging and other molecular testing, that allow us to do a much better job of figuring out which men are likely to have prostate cancer, and then they go on to receive biopsies and baby treatment.
And testicular cancer, another really sensitive subject for a lot of men, obviously. What do men need to know about that? And I understand the guidance around it has changed over the years.
Yes, exactly. The United States Preventive Services Task Force actually does not recommend that young men, and young men are the age group at risk for testicular cancer, the task force does not recommend routine testicular self-examination. That recommendation, however, is based upon the fact that there's been no really super great studies to look at this. It's obviously pretty easy to examine yourself in the shower. Go ahead and do it once a month. Feel for any lumps or bumps. And if you feel anything, that's when you should call your urologist.
One type of cancer we don't often hear talked about is bladder cancer. Why is that something that's important for men to pay attention to, and what should they be looking for?
Yeah, this is really important, and I'm really glad you asked that, because I think this is someplace where we could really help the men of Central Texas. The main symptom of bladder cancer is blood in the urine. And unfortunately, a lot of men see this and they kind of blow it off. Bladder cancer, when it's detected early, is quite curable. It's a big inconvenience, but it's quite curable. Bladder cancer that is advanced requires some pretty intensive treatment, including major surgery and chemotherapy.
And just sort of speaking generally here, what are 2 or 3 things that men can do right now just to promote their health, to take better care of themselves?
I think there's a few things you can do. Number one, talk to other men. Share the issues that you're having, and certainly try to get a regular physician and try to get an annual visitor. So, get your screening tests, get your colonoscopies, get your PSAs, get your other lab tests, get examined by a doctor, have your blood pressure checked.
All right, Dr. Stuart Wolf, urologist with Dell Medical School and Seton Urology Group. Some really important information, doctor. Thanks so much for being here.
Thank you very much.